We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick.
That was President Obama addressing Congress in 2009 about a key aspect to his health care law. But now we've learned it'll be another full year until the government limits out-of-pocket costs for health coverage, the provision the president was discussing there. A report in the New York Times explains how federal officials have delayed the part of the law that required insurers to cap the amount they charge patients for deductibles and co-payments. The report says the administration felt employers needed more time to implement the policy because their computer systems needed to be upgraded. Joining us now on set, Democratic Representative from New York, Congressman Gregory Meeks, and in Oklahoma City, Republican Representative from Oklahoma, Congressman James Lankford, Mike Barnicle, Donnie Deutsch, and Brian Shackman with us as well.
Full disclosure, the congressman represents the district where I grew up.
Oh, great.
House Hills, Queens.
Okay. Well, we'll try not to hold that against you, Congressman. It's okay. It's okay. You need a diverse population. All right. So, Congressman, let's start with you. It's got to be hard at this point. And what's the challenge in defending this law that seems to get shot down at every turn, whether it be economic factors or access to care, actual implementation of it?
Well, I don't see it being shot down. I think that anytime you have a bill that's substantial, that's big, there's no perfect bill. I've never seen a perfect bill.
It's a challenge to defend, though, is it not? Well, because people don't understand it?
But you look, when Social Security first came out, people didn't understand that completely. And when Medicare came out, people didn't understand that completely. But over time, we developed it and we got it right. You know, the fact of the matter is, when the Constitution came out, people didn't understand that. And there were problems in the Constitution. We didn't say get rid of the Constitution. We fixed it. And what the president is doing here is saying that listening to all the people, he's the president of all the people, business, consumers, and otherwise, there's problems. And so when there's a problem, let's fix it so that it works for everybody. And that's simply what's happening here. It's like rolling out a car. You know, when people come out with a new product, they try to fix the glitches that's in the that might be in the product. It doesn't mean you get rid of the product.
Well, and to add to that argument, it's not like anyone else could get health care done. And it certainly wasn't going to be easy. Having said that.
And the goal is, I mean, I don't think anyone could disregard the goal is to give every American, the 30 million Americans that don't have health care, to make sure they have health care. And why? That brings down the cost of health care for everybody.
But that's a long time away. Let's bring in Congressman James Lankford. And I think the challenge on your side of this argument, sir, might be, tell me if you disagree, the divisions within your own party as to how to fight this. If it's such an important fight to you, you guys can't even agree as to whether, to bring it down or to change it or what.
Well, the challenge really is for the people back in my district. We're trying to do whatever we can to protect the people from our district from the harmful effects of this law, while still understanding that there are good motivations. What Gregory Meeks just mentioned on is true. There's this good motivation to try to cover people, but the problem is the actual rolling out of the law and what the law says versus what it does. It doesn't really cover the uninsured 30 million people. The CBO has come back and said 10 years from now, 30 million people are still going to be uninsured. The business mandates are not working well. It costs too much to be able to implement that, so they're delaying that for a year. Now, this is another delay on the cap for a year. It's this continual, this is the Affordable Care Act, but the more they roll it out, the more they find out how much more expensive it is for businesses to implement and to actually carry. I had someone in a town hall meeting last night in my district say that their son, who normally pays just over $200 a month for insurance, just got his insurance for next year. It's going to be over $800 for him next year. He's a person in his 20s, and he finds this catastrophically large insurance rate that he can't cover. So there are major issues that have to be fixed.
So, Mike Barnicle?
So, Congressman, if he's in his 20s, if he's under 25 or 26, whatever the age is,
he's over.
He's over that age. Okay. So you mentioned the word harmful effects. What would be the harmful effects on your constituency, on your constituents who currently have no health insurance? What harmful effects could be imposed upon them?
Well, let me give you an example of that. I had someone about 3 weeks ago that came to me, and it's on a plan that we have in Oklahoma for those that are in poverty called Insure Oklahoma. It's a plan that's a plan that we developed as a state to cover people that are uninsured. he's going to lose that insurance and have to shift. He doesn't know what the exchanges are and how it's going to go. He came to me at one point and said, I don't want to lose my Insure Oklahoma. We specifically asked for a waiver on that, say we want to continue to cover that. CMS and the White House denied that request of that. That's one. I mentioned already this gentleman has gone from just over $200 to paying just over $800. There are physicians that are leaving their practice. There are serious issues, and we've reached a time where lots of folks are denying these problems are really out there, but the closer we get, the more that we see there really are real problems, and Republicans just aren't paranoid and trying to do conspiracies. We really see real problems with issues.
So, Congressman Meeks, are there legitimate issues that he brings up? It sounds like real numbers there.
Well, the problem that we have, as I see it, is ordinarily we would get down and we would work together to try to figure out what we could do and what we can compromise. What we've done over 40 times in the House of Representatives is just vote to abolish the bill. We haven't talked about problems. We haven't talked about how we fix problems that may be there. The only thing that we've talked about and the only votes to come is to get rid of the bill. I would think that what we should do, and I think the president would be amenable, if we would actually be sitting down and try to work out, as the president has done. I mean, clearly these two fixes that the president is looking at, it's because he heard from people, they made a point, he agreed, and therefore there's a delay.
Well, the question really is, how does that happen? Because there are very few people at this table that would disagree that voting 40 times to repeal it doesn't help anybody, but these delays that are now three major ones, I believe, is there an existential problem here, though? Are we looking at we're delaying it because we don't have a solution even on those that support this?
No, because if you look at the overall good of the bill, those things are still being accomplished. As just indicated, if you have a kid that's under 26 years old, they're now still covered. If you have a pre-existing condition, you're not going to be charged more. You can't be charged more because you're a woman. Yeah. So those things are going into effect now. That's helping us right now.
Congressman
and we don't want to get rid of
Lankford,
those things.
are the fundamentals good in this law?
The ideas are good. The problem is the execution of it and where it's being carried out. Again, when it's happening in Oklahoma, when we're working hard to be able to cover the people, we worked out specific ways to be able to handle this and to be able to walk through the process on it. When it happens on a large global scale like this, it shifts everything. Take, for instance, just the people 25 or under on that. That's a nice thing to have happen. The problem is now someone who's covered under their parents' insurance that actually goes out and gets a subsidy because they live in another state, their parents could cover them. They could face a penalty on that in the days ahead. What happens if a person actually signs up for the insurance, gets the subsidy, and then 3 months they stop paying their premium on it? The federal government continues to pay their part of that for the rest of the year. There's no real clawback on it. There's so many issues that are out there flying around. You find out this is a large Rube Goldberg that is very elaborate on it, and this whole thing could be done in a much simpler way. The challenge is not to do Americans like health care.
It would have been done. So I will take issue with that. We have to leave it there. Congressman Gregory Meeks and James Lankford, thank you so much. Up next, one tweet from this billionaire investor.